Good morning, everyone, and welcome to this webinar, to this URBACT webinar on social data. My name is Margit Thünemann, and I'm from the URBACT Secretariat. I want to share a few words, quick words about URBACT. For those who are not so familiar with the program, we are a European funding program for cities, and we promote sustainable urban development through cooperation projects. That means we fund cities' networks and capacity building and knowledge sharing activities. Like this one here, this webinar, this is part of such knowledge sharing activity. And we are meeting here today with cities of our Knowledge Hub on social data. This is our second webinar in a whole series. Based on a survey amongst the partner cities from several networks, the cities have designed a series of webinars in order to explore and discuss various aspects of social data management. And last week we met for the first time to set the scene a bit. And if I may mention one thing from last week, what really struck me was how well the webinar showed how important it is for cities to have really good data, the right data, local data, and accurate data, granular data that is really reliable if they want to do good policy making. The ultimate goal of this webinar series is that we create a guidebook on social data management based on the local experience, and that we want to present it at the URBACT City Festival, end of March, beginning of April this year in Cyprus. There are, by the way, a few spots still for cities who didn't register yet, so maybe you want to check this out. A little note on this webinar, it's a workshop, so it's not a ready-made tutorial. We are working together, we are collaborating together, and as usual, we are doing this in a cooperative way. So it's open also to the public. We want to include also other cities, other actors in our work and bring forward, please, also your own practice, your experience, share questions or ideas that you have. So really open to gather your knowledge as well. We plan to end this webinar around 11:30. It is recorded, as you realize, and we will share, of course, all the slides afterwards. So on the dedicated webpage, you will find all the information. To interact with you during this webinar, we would like to use WooClap. This is the QR code. You can maybe scan it already with your mobile phones, or you go to the website and you find the event code here on this website, on this page. I will share it also again later, but maybe you try it now already with your phones that you're there and running. You just need to scan it once, go to the webpage, and you will find this event, and then you can also contribute later with your ideas and questions. We will also use the chat function of Zoom. So if you have questions in between, you can put them in the chat, and later during the webinar, we will come back to that and try to answer as much as possible. If there are more questions, we might also put them on the website after the answers on the website afterwards. So having said that, I would like to really start with the webinar and give the floor to Sofia Aivaliotti. She's one of the experts of the Knowledge Hub on social data and the lead expert on our network for One Health for Cities. She will facilitate the webinar today and share her valuable expertise. So thank you very much, Sofia, for being here, and the floor is yours.
Thank you for the introduction, Margit. Good morning. Hello, everyone. I will shortly introduce our four networks that we are involved for this Knowledge Hub activity. So we have One Health for Cities, a network working on introducing One Health in public strategies, policies, and projects. One Health unites human, animal, plant, and environmental health for interlinked and interdependent urban interventions. We have URBACT, which prioritizes social impact and community-based practices by reimagining the way urban regeneration actions are conducted. We have Cities at Heart, that focuses on achieving a balanced and inclusive city center for all users. and Next Gen Youth Work, which is developing a hybrid and sustainable future for youth work through innovative digital solutions at the city level. As we can see, we have very different topics, but all of them, they highlight the social dimension. It's all transversal to us, and that's why we're here. This guidebook that we are working on, it's not going to be limited to those networks. We include also cases from participants from this webinar, so we are looking forward to share these cases, and also other URBACT cities that want to collaborate and share the cases with social data. Just in the first webinar, what we saw was what social data is and why they matter. We discussed about the data sources that cities have and overall challenges. And we had 3 different case studies showing us how they use data for various social policies. And it was quite interesting. It's also recorded if you want to go back and you missed it. On this webinar, we will have an introduction on social data collection and management, and we'll have 3 more cities from Finland, Portugal, and France invited to share their case studies and their experiences with social data. And that's the main part of this webinar, to have like more in-depth cases where you can see and experiment and ask questions about how other cities, they deliver their social data collection and management. We will also have moments for especially towards the end, for questions and answers. And we will discuss through the chat, or we will ask the panelists to respond. But feel free to already, when you have questions, to put them in the chat, and we will start to respond to them. And we will close with some remarks in the end. From the previous webinar, we saw that most challenges with regards to data is the data quality, availability, interpretation, data protection, and we will explore these themes today as much as possible. Just starting with our theme and introduction of this webinar, we're talking about social data collection and management, and we will just orient you with a short presentation. First of all, why we talk about social data? A quick reminder, social data are data generated by or about people and communities that describe social conditions, behaviors, interactions, and lived experience, and that can be used to inform and evaluate public policies. Cities are a very data-rich terrain, and especially with all the technologies and means we own at the present moment. But this doesn't mean that we make social policies using the power of these insights from data. And policies can be often data poor, and this is why we want to tackle this topic. In the next slide, social data only drives change if it is collected and organized systematically. Fragmented processes, inconsistent methods, unclear responsibilities limit the potential. Define what to measure, how often, how to manage and store. It ensures data is reliable, comparable, and directly can inform policy priorities. We saw also in the previous webinar from Mar that there are many ways to produce and access social data through surveys, fieldwork, citizens collaboration, through national statistics, through casual data like social media, etc. Here you can see different ways. It is not about selecting the best approach, but combining methods and get the most accurate results and verifiable results. So it's not only choosing one of these, but combining and find ways to create a more realistic image of what we want to measure. In the next one. Social data is all around us. We need to set up the right processes to collect them, but they can be also a bit tricky to collect. Social data often challenge dominant narratives, expose vulnerability and inequality of those providing the data. They can be political, sensitive, and oftentimes invisible. Therefore, making engagement process for data collection, it is not a straightforward process. Social data collection requires trust from citizens and capacity from the city to set up these processes for collection and data management. There is a difference in social data with some being more sensitive than other. Like we have personal data versus environmental data, for example. So we need to also treat them in a way that they require. We need to be realistic. It is difficult to develop the perfect data collection processes and tools, risking to delay important social policies. So we need to act. And that was also the advice that we got from the City of Granada from the previous webinar. We need not to wait for perfection, but just start doing it and taking action to use data for policies. We need to highlight that in order to start handling data, we need to define the scope of such data, what do we want to verify, to discover, and have a focus on our efforts, channel our efforts on specific objectives, tailor solutions on how to collect, manage, and analyze data depending on our context, capacity, and needs. And what is a good advice is to start from where we are, on the data that we have available, and there is plenty, tools that we own already, accessible expertise, and ambitions that can be materialized, be realistic about what we want to achieve, and not to copy or buy complex tools and processes that imitate, that copy other cities, different contexts, that they are not suitable for our realities. Below you can see some examples on data collection and analysis with more extensive examples coming from our cities, the invited cities that we have later on. In the first example, we have two citizen collaboration, citizen science platforms. The BCZen is a platform for urban cyclists to share their experiences regarding bike lane quality, safety, parking, aiming to improve urban infrastructure. This was developed by the Autonomous University of Barcelona. The crowdsourced data can be used to improve cycling infrastructure and advise urban planning and urban mobility projects, while the results may also be used to research by university and other purposes, like from private sector, for example. And the mosquito alert seeks to fight against the tiger mosquito and the yellow fever mosquito, species that transmit diseases such as Zika, dengue, and chikungunya. In this case, citizen participation consists in sending photographs of insects observed in the environment, and they are likely to belong to this species. A team of professionals analyzes the images to validate the findings. The data generated allows to monitor to make predictions about their behavior, which help control their expansion. And with this information, they can create more environmental and social policies. All this information is shared openly through a global biodiversity information facility of Spain for further use as well. And these are some examples of collaborative tools where citizens become the scientists and provide the data. In the next slides, we have the example of the city of Munich, that they have launched an extensive citizen engagement process for the first time in their health department team. They had 4 workshops in different locations of the city in a drop-in format, and people didn't have to stay there for a certain amount of time. They were coming in, giving their inputs, and going away at any time during the duration of those events, and then allowed the city to map perceptions of different citizens with regards of their daily habits, perceived health, and their needs, with the aim of the city to design actions for their city health strategy. The easy and creative approach, and also quite comprehensive and organized, allowed for the high number of people to participate and to be part of the city health strategy. However, we've noticed that we need to be careful with such engagement processes that may not represent all target groups, especially some vulnerable populations that may not have the possibility to attend, or they don't have the time, or whatever is the reason. So it requires complementary efforts in data collection for unrepresented groups if it's observed it's necessary. Another example comes from the city of Lulé in Portugal. They have released a very simple questionnaire to collect ideas on One Health action and needs. This questionnaire was given during public events, and it was available also online. And the municipality, in a short period of time, managed to collect over 450 responses. The solution was easy, cheap, without the need of a big ICT infrastructure behind it, and it targeted also social policies about One Health. It's an accessible format for all ages, most capabilities, and it was an easy and effective approach to get like this social data, these perceptions, these ideas from the citizens on their needs for with regards to One Health. And one more example is for data collection. It comes from the city of Dordrecht and from the NGO Vogelnest. Vogelnest are community managers that run this community kiosk, among other things that they do, and they help the city. They are the best place to discuss with citizens, map problems, promote new projects for improving the neighborhood. The kiosk is located in the heart of the intervention areas, and it's a space for social cohesion and dialogue among citizens. They also collect data by knocking people's doors, so they go directly where their target group are. They offer oftentimes free plants or coffee, and they make a lot of community events. And this way they stay involved and accepted by the whole community and get access to groups who are not easily accessible or well represented, meeting the citizens where they live and work. Yeah, these were a few examples. And now we would like to hear from you and use and try the WOOC Club. And we'd like to ask you, what tools and methods do you use to collect social data? How do you access your citizens for collecting the social data?
I'm showing once more the QR code in case you haven't managed yet to connect to WooClub, or you try it via the website and the event code. So I hope, or I see that some people are still joining, so I leave it for another couple of seconds. Meanwhile, the others can think already or type already what they want to contribute.
What tools and methods do you use to collect social data? How do you access your citizens? And especially we want to see this more sensitive or invisible data. Like what is your approach there?
Okay, so let's see. Use surveys. Questionnaires. Interviews, research, focus group meetings, but a lot of surveys. Google Forms, emails also.
A lot of online connection. Roundtables.
Participatory labs. The census. Maybe there's some more to come, or it stabilizes a bit. Good. Are we fine with this, Sophia?
I think so. I think
Big
it's
picture?
stabilized. Yeah. I
Great,
like
great.
I like the phone calls. I would like my
Yeah,
city to call me. Okay.
that's good. Okay, so we leave it at this and we go to the next slide.
Thank you very much for your input. It's also good that you tried the Google app, so you know now how it works. So, um, So when it comes to data management now, we have many critical aspects where data is managed, where data is stored or shared, which software is used, and like the ownership of data. So there is all these questions. And if we go to the next slide. And we need to know that data handling, it's not only about collection and analysis, but requires a comprehensive approach on how data decisions are made and implemented throughout the data lifecycle. It is not about it's not merely like taking only one part of these steps. We need to look from the beginning, the planning, the collection, the analysis, sharing data, and how social data are stored. All these are critical steps in the path of handling social data. It requires strategic, legal, and regulatory consideration to minimize risks, ensure accountability, and optimize data assets. One more example we have from the city of Bilbao. A formal way to establish data governance comes from Bilbao, where they have adopted this data manifesto. The manifesto aims to establish a framework designed to guide the responsible, secure, and ethical use of data in the city's management, important for the data governance. The Bilbao Data Manifesto is a collaborative initiative between the city council and some 50 professionals in the field of digitalization and open data. It is a shared consensus-based guide that sets out 10 ethical principles based on Bilbao charters of value, which will govern data systems. The participatory approach to develop this included surveys and co-creation workshops. So it was important that it had this format of co-creation and not top-down delivery. And that was an example for governance. And when we look at data, we have many considerations, such as the data classification, interoperability, availability, quality, integrity. I think you understand all of them, that they are necessary. Sometimes we forget this long list, but we need to think about data protection, privacy, security, engagement, capacity building, the cross-border data flows. That is some of the newest nuances in data management, liabilities in the cloud, etc. These are very important for data, but even more important for social data, which are more sensitive. So in the context of social data, we need to have an even more careful approach. Social data often involves people, identity, behavior, lived experience. What is technically non-personal can still be socially sensitive. Misuse can stigmatize groups, reinforce stereotypes, or justify exclusion. Social data collection depends on citizen consent, trust, and perception, something we mentioned already. People may withhold, distort, or resist sharing if trust is lacking. Open by default approaches can be harmful for social data, and equity lens is required. Who benefits from the access? Who bears the risks? And biases in social media, in social data, sorry, can also result in biases in AI outcomes, tools, etc. So we are replicating or magnifying these biases. And automation can scale injustice faster than human systems. So we need to have these extra thoughts on social data. Therefore, social data governance requires data literacy by both citizen and city official. This entails a lot of things that we may need to explore further, and also in the guidebook, for example. It requires participatory design on the collection, analysis, and interpretation of the data. It's not only about the collection, but also how we communicate those data. And it requires ongoing engagement, not one-time consultations for collecting the data and finishing there. Data governance is as much social infrastructure as technical infrastructure. So we need to think it as this and not merely thinking of technology, ICT, quantity of data. Social data requires purpose limited and contextual sharing. So we need to define this in the scope of the social data collection and purposes. Stronger accountability and human oversight is required. I have a few more examples, and here is the example of DCD, which is a digital platform for citizen participation. It's free and open source software maintained by an active community. And first, the data are collected in local councils in the neighborhoods and then goes to this digital form. It also involves a multidisciplinary approach, combining local events, like having like these physical interactions and discussions, and then this pass into the digital tool, at least for the case of Barcelona. It combines methods to really get into people's needs, and only digital approach and tools may be misleading, as we've seen from various experiences. So we need to combine these physical and online forms. And we need also to contextualize before we go to solutions and policy designs. So we need to keep this in mind. A more common and ambitious example of data is the digital twin. In the case of Rotterdam, they combine digital infrastructure with social and physical infrastructure to develop a model for the city that can map a wide variety of data that can lead urban planning, environmental, and social services decision. The digital twins are much more than a digital replica of physical systems, people, and environment. They are different from other data analysis and visualization approach because they can integrate data from various sources and in real time, and assess not only the present but also create scenarios for the future and create advanced simulations. So that makes it more interesting if we want to consider like changes in socioeconomic characteristic of a population or population growth, etc. So these simulations can help us plan also for the future. And then when it's applied in this urban context and the social, it can also advance how cities approach their management, monitoring, and future planning and decision. And another digital twin that is mapping social infrastructure comes also again from Barcelona. And this is maps where social services are and if citizens are served with equity. So it gives like a percentage and a distance and how well everybody is served. So mapping and visualizing social data can bring new vision of the city and how it should be planned for the future. So this shows us the value and the power of data if we use them in big contexts and with a high amount of high quality data. We will have one more question about in Google Club. So get your phones back. And we'd like to ask you who collects and analyzes your social data. So we want to understand where you are in terms of capacity for collection and analysis. And afterwards, we are passing to our case studies.
Yeah, so we share the QR code once more so that you can all contribute. Okay, I think most of you are there. Then we would ask the question once more. So who in your city is actually collecting and analyzing social data? Is it rather limited capacity still? Are you using mainly statistics like from national or regional offices or national or regional data? Or is it already a bit more advanced? Do you use internal data, your own municipal data that you maybe share in a team, a municipal data team? Is it mainly city-generated data? Or maybe you also rely on external support through local experts, or you take data even from NGOs, or you have consultants or data firms, IT firms that you ask for support. Maybe you also have other ways, and we can maybe share it through the comments. Who is collecting your social data for you? maybe it's also a combination of things, of course. You can add several.
That's probably the other. Can you answer several
Yes.
times? Yes, okay. I think we are in between low capacity and quite high capacity, so we have different speeds of cities.
And it may be even different within the city. I mean, some departments might already be quite advanced, have a lot of data and use also external support or have quite advanced systems to analyze them. Other departments might be not so advanced. And I guess that social data collection and analysis is one of the more tricky ones.
Okay.
Okay,
I think we can leave it to that.
good.
Thank you very
Thank you
much
very
for.
much.
And yeah, we're gonna get into our case studies. I think that's the most exciting part of this webinar. And I would like to invite Kati Vahasaria from the city of Kuopio. She's a service manager from the Civic Services in Finland. Please, Kati, take the floor.
Thank you very much, and good morning or good afternoon to everyone. My name is Kati Vähäsarja, as Sofia told you, and I, at the moment, actually, my title or my position is Manager of Community Services. Used to be Civic Services, but now it's Community Services, and that includes many kind of promotion activities and personnel in our unit. So let me share my presentation for you. Should see it, and then I put. Okay, can you see it now?
Yes.
Okay, good. So thank you for inviting me to this seminar. I'm really glad to be here with you today, and I present you some example of our city of Kuopio. How do we collect and manage data for social policies of well-being data actually in our cities? And the city of Kuopio is a Finnish city of 126,000 inhabitants, and we are located quite in the middle of the Finland. And I work for the well-being promotion sector, and I work as a manager in our unit of 30 people, approximately 30 people. We have a culture promotion, physical activity promotion, well-being promotion, substance abuse prevention, and all kinds of things. So we are handling many kinds of data. And my unit is responsible for the cross-sectional well-being data management. So we are coordinating the data collection and analyzing and reporting in my unit. So I will first explain or present you what kind of purposes we are collecting data for. And then at the end of the presentation, I will give you an example of the platform where we are collecting and reporting our well-being data. So where do we need well-being data for? So we definitely, in all cities, we need to create understanding of our citizen well-being status, and we need that information for defining our strategic goals. And we are we really want to offer politicians correct information about our citizen well-being to make sure that they will make right decisions to improve citizen well-being. And we need to have proper information about the well-being of the citizens to plan and evaluate actions and the effects, and especially the effectiveness of our city's actions. And we always need to evaluate the impacts of the decisions. We are doing actions, we are making decisions, but we have no idea about the effectiveness if we are not evaluating the right indicators. And we need to have data to communicate and to promote well-being of the citizens. And of course, we need to base our budget to something, so we need to have proper, good quality well-being data to make right budgeting decisions. And it is not only our cities need to have good quality well-being data. In Finland, we have a Finnish Act on organizing healthcare and social welfare, and in that act, we are advised how to how to report well-being data in our cities. So this act says that municipalities must set goals for the promotion of well-being and health, and we need to define the measures that support the strategic goals. And if we are thinking, how do we have to report and when do we have to report, we give the rules from this Finnish Act that we must monitor the living conditions of the citizens, well-being and health of the residents, and the factors affecting them. And we need to monitor and also report these issues annually to our city council. So this is based on law that we have to report our citizen well-being status annually to our decision makers. And we need to prepare a well-being report once a year, and we also have to make a wider well-being report for every city council term, which is 4 years in Finland. And we also need to prepare a plan for the council term, which is based for the well-being information, well-being data. So every cities in Finland must do this kind of well-being report and plan annually, and wider report and plan in 4 years. And we also need to report our well-being reports and plan to the regional well-being area, where all the health and social services are nowadays located in Finland. They used to belong to the cities, health and welfare services and social services, but nowadays they all belong to regional well-being area. So different organizations nowadays, but we need to report, and they need to report to cities as well. And we also have to, based on law, publish our well-being data on public online platform. So what do cities measure and how do they report? The law says some advice is what we have to do, but the municipalities can determine the indicators themselves, what kind of indicators they are evaluating and measuring and reporting. In Kuopio, we collect well-being data from several sources. They are local sources, they are national sources, and this data from different sources form a basis for our general well-being plan. And in Finnish law, it is also said that we have to make a separate plan for children and youth well-being, elderly well-being, and also for citizen safety. So we have included all of these law-based plans into one citizen well-being plan and report. So we need a lot of data, well-being data, to create these plans and reports. And of course, our goals, our strategic goals, they must be based on well-being state of the citizens. And the municipalities can also determine the form of their well-being report. We are not told what kind of reports do we have to report. We can decide by ourselves. And there's a great variety in Finland what kind of well-being reports cities are making. And in our city, in city of Kuopio, we have wanted to be forerunners in our reports because we feel that it is very, very important to report to political decision makers clearly and precisely, and to make sure that decision makers are interested in our well-being state and data to make the right decisions. And we feel that data is only valid when it is utilized and when it is used. We have a lot of data of our citizen well-being, but if it is presented in a way that politicians, for example, are they don't feel tempted to read the reports about the citizen well-being, then there is no use for that kind of well-being data. So we need to have data which is reported well and in the way that the report is read and used for decision making and planning of the activities. So we felt in our city that we must have a clear and understandable way of communicating about our citizen well-being, and that has to be understandable for also lay residents, which usually are decision makers that we cannot accept they to be professionals of well-being. So we need to report clearly. It has to be tempting, it has to be visual, it has to be interesting, and there has to be comparable. There must be a chance to compare different cities and different age groups, for example. And the biggest challenge is that it has to be comprised, but at the same time, it has to be extensive enough to give enough information about the well-being. If it's too comprised, it doesn't give enough information, but if it's too extensive, then it's too exhausting to read for others. So that is always the challenge. And we need to build systematic data collection, data analyzing, data reporting, and use of data. That has to be systematic according to our strategy, our well-being plan, well-being report, and also budget planning and planning of all the activities of the city organization. And now I will go to our website where it's our well-being report. We have been using Power BI platform for creating our well-being report. And there are data coming from different sources to this platform. And this is what we use annually and also in 4 terms reporting to make it as easy as possible for politicians and also for departments to make their plans and make the decisions of the activities to improve citizen well-being. And this platform enables us easy data updates and visual presentation of the statistics, and it makes it easy to make choices of the determinants to make comparisons. And this well-being report forms the basis for our well-being plan as well. So let's go here. So before this Power BI version, we have had this now about 6 or 7 years. But before that, we reported in PowerPoint presentations or in Word presentations, and they were exhausting and exhaustive. So we felt that we need to have a nicer way of reporting our well-being status. And we have now been using this Microsoft Power BI, which we have felt very good for us. So in this image, we want to present all the main themes for our well-being. And in our city, our aim is to become a capital of good life, and we call these elements as elements of good life. So this is easy to understand, this image, that there are five different parts which all are related to each other. It is about lifestyle, it's about social networks, it's about hobbies, activities, employment, education, and environment. And this makes our reporting systematic, and reporting and also evaluation and activities planning systematic. We are all the time using these same 5 elements in all our well-being data management and reporting. So we can export data from, for example, Excel here. So this is easy way to keep data on time. So we can always add the new Excels here to provide the in time information and data for our well-being reports. So this is the English version. This is like an example version. We have a more complete version in Finnish, but to show this in English as well, some of these sentences are translated to English as well. So here here are the 4 main challenges which we face in our city. We have a high morbidity, we have a high mental health challenges score, we have overweight and obesity problems, and also health and well-being inequalities. And I think quite many cities struggle with all these same challenges. And here we have cities, other cities, biggest cities in Finland. Kuopio is the 8th biggest city, and we want to make comparisons between the biggest cities in Finland and also the whole country comparisons. And here we can choose indicator which we want to assess or explore. For example, here the amount of people who have experienced strong positive mental health within the previous 2 years, 2 weeks among the young students. So we can here choose, and we can see the cities. Kuopio is the black line. So for us, it seems very nice that the prevalence of positive mental health is increasing. And here we can also assess, we can also combine girls and boys, female or male, or we can explore only females results or male results. And most of the data comes from the national statistics, where we have also city-based data, but then we also collect data in our own city. Here are the life patterns at in the above. No, on the top of the slide, you can see that we have made some clear sentences, what you can see from the results or statistics, to make it easier to read. What is this about? What is the statistics telling for us? But then when you want to explore more in detail, you can tick whatever you want to explore more in detail, and in which group, gender group or age group or city. So you can make easily the comparisons here. So this was about the lifestyles, and social relations and support. We have plenty of indicators here. As you can see, you can explore very in detail what do we know about our citizen well-being, and then always check how are we doing in Kuopio in comparison with other cities. And also, I will just quickly go through this just to give you an example, and you can go to this website by yourself as well if you are interested and explore more this data. And we have really felt this Powered by very useful for us, especially that, for example, political decision makers, they can easily see the main points, but if they are interested, as we hope they are interested, they can explore in more detail and become more aware of our citizen well-being. So this is, I will only show you these examples. I hope you will get the image how does this work. So this is our well-being report. So we will always report it here in Power BI, and then at the base, based on this report, we always make our well-being plan. And the plan is made based off this information here. We can see what are our main challenges, what do we have to do, and this is also easy for our city officials to check how is it going in our city among different age groups and population groups. And I think I have now taken all the time, 15 minutes approximately, so I will finish my presentation here. I hope you will have some time, if you have interest, to explore more of this through this website, and you will you will get this presentation from the organizers. Thank you very much.
Thank you, Kati. And before you say goodbye to us, I have a question, because I know you might not be until the very last minute.
Yes.
So there is a participant asks that and comments, it helps a lot to have a national framework for well-being data collection.
Yes.
How do you make sure the data is collected in a valuable way and not only ticking the box? How is the reporting work made useful and how people collecting data become engaged? So,
Yes, thank you for the question. Yes, we have different kind of data sources, and those which are national, they are based on questionnaires, and they are usually population-based questionnaires, or they can be based on some services like social services information or data sources. So they are, I believe they are reliable, but then if there are some surveys which are not population-based, so then, of course, you need to note that they are not always reliable if it's only just a survey for citizens. But we always try to get population-based data that you can, you know that it reflects your population. I hope I answered. And
if there is further questions, we will take them and then also direct them to you if needed, if
yes,
we cannot answer them now.
Very good.
Thank you so much.
Thank you very much.
And I will now give the floor to Vitor Moreira from the municipality of Famalicão. He's the head of smart cities for the municipality, among other things, if you want to mention. And please, yeah, take the floor.
Okay, thank you. May I share?
Yes.
Okay. I think you can see my screen.
Yes, it's good.
Yes. Okay. Thank you. Thank you. Good morning, everyone. I will try to share with you our experience in Portugal to collect data. I will. I like to start with this. What we are talking about. We are talking about this knowledge pyramid. All organizations in our municipality, we have a lot of data. And we need to improve our knowledge to become data information and then in knowledge. Because it's the most important for our organization, for the mayor, is how we use the data to create information and how we use this information to create knowledge. And this is not easy for our organization, for the municipality, to change data, to create information with data, because we have a lot of data in our organization. All municipalities have a lot of data, but sometimes, a lot of times, we don't have the right way to create information, to proceed this data and create information, and to context this information to create knowledge. We are talking about this today and how we use data to create this information. And before I present Famalicão, I want to share with you this pyramid because I think is very important for the context of our presentation. Famalicão, Vila Nova de Famalicão is a medium city in Portugal, in the north of Portugal, near Porto. And I will show you some facts about us. This is our, some words are in Portuguese because our platform is in Portuguese and I cut this picture from them. But this is our pyramid, demographic pyramid. And we compare Famalicão with Portugal. At the left we have Famalicão, and the right we have Portugal. In the right here, in the right map, we have the foreign people in Famalicão. Where they come, we have this kind of information. The most part of the people in Famalicão, the foreign people, the immigrants in Famalicão, come from Brazil, because we work the same language, and we have this. We collect this kind of data. In health, we have some, and housing. In the left, we have information about housing. I will show you our observatory where we have this information, but we have information about housing, about health. This is the percentage of people in Famalicão have public doctor, and in Famalicão less than 1% without public doctors. And in Portugal, we have a problem because 15% of people doesn't have public doctor, family doctor. We have a lot of problems about this. And this, we have this information when people go to the hospital. In the hospital, they put a bracelet, green, yellow, orange, or red. And we have this information, and it's possible to talk with the people, with our community, to share with the community this kind of information and act with this information. Information about education, how many people go to the basic schools, public basic schools, private basic schools, and secondary schools, public and private. And people in Famalicão, people with high degree education, we have 16% of the people in Famalicão. In Portugal, 21% of the people have high degree. I will show you something about this. This is the information about economy. We have this information about how we spend with electronic cards in Famalicão. Payments with electronic cards. We have this information month by month, year by year. In the 25 until October, we don't have more information until now. We spend 630,000 million euros with credit cards, with electronic cards in Famalicão. And it's possible to manage this kind of information. So let's talk about our framework, the framework, how we work in Famalicão with data. This is our framework, the smart city framework. This is not a subway map in Famalicão because we don't have subway, but this is our approach for a smart city. In our view, in our point of view, this is like some 6 subway lines, and all this, each line means a department, means a lot of another institutions, and sometimes we have our own line, but sometimes we need to talk with other lines, and it is what this means. We are not alone. When we create a city, when we create a smart city with data, we are not alone. We need to talk about something with another lines. So that's why we use this methodology to show how we need to create things up with community, with the stakeholders, with another departments in the municipality. We are not alone. It's the major word. And how we collect this data. We collect this data from this framework. We collect this data from integration from another platforms. We introduce manual or from files from Excel or from Google Word, Google Forms or something, collect data from the other ways, and we collect from IoT. We put this information in a geographic platform sometimes, or we put in data governance platform, our observatory. I will show you. And we collect again. We collect from open data, from European open data, Portuguese open data, and from other municipalities around Famalicão. And we manage all this data in one or two platforms, geographic platform and data governance platform. In the geographic platform, you can see this is the territory, this is master. The discussion of our master plan was made in this geographic platform. This geographic platform is a Google-based platform, and everyone in Famalicão comes here, draw a small area, and participate with some opinions, something in the construction of our master plan. In 2025, we rebuild our master plan for the city, and everyone can come here. We have 1,101 participation, and we have this dashboard about this kind of participation. This is our way to engage our community. It's very important not only participate, but engage our community. And you can see this is our observatory. So as you can see, the first is the geographic platform, is this geographic platform. The second, data governance, is this observatory. I can show you by directly website. I think you can see now. Yes?
Yes.
Okay. Sorry, this is in Portuguese, but maybe I can translate. Maybe, yes. It's possible to see. We have this for us, this observatory is public. You can see this link is a public platform. Everyone can come here and see. We divide previous colleague, we divide this in 5 areas, 5 agendas. Dynamic integrator is the social, qualified education and youth, dynamic economic, ecological environment, and the participate is about governance, a little bit about governance. And we have information about how we spend our money. Every second we share our information about this. We select some areas, and we join information area by area. And we have here, if you choose this area, it's possible to choose economic activity and have information about economic activity in Famalicão. How many companies we have, how many, a lot of information. And it's possible to compare with the north of Portugal and with Portugal. We have here some information. It's possible to let me show you another area, maybe health. I can show you data previously. Sorry, but just a few seconds and we have this information. Born in Portugal, we have 7.5 children per 1,000 inhabitants, and in the north of Portugal we born 7.1. But if I change here, with Portugal, the color change. And in Portugal, in Famalicão born 7.5, in Portugal 8.1. So, and in every time we can compare Famalicão with the north of Portugal, our region, and with Portugal. And this is very important for our communities and for us to manage the city. So I think, I don't know if the time is it's okay. I think I spent like 15 minutes.
Yes.
Yes.
So just about now.
Let me, and this. You see the thank you slides? Yes or no? Yes.
Yes.
Okay.
Thank you.
Thank you. Sorry. Thank you for this time with you.
Thank you very much. I just to remind everyone, if you have questions, please ask them to the Q&A section so Vitor can respond to you or we can respond to you. And thank you very much for the interesting case and all these great tools. If you have any links, please also share. And I will go now to the city of Lyon, to Pierre-Louis Debord, project manager of the Health Observatory for the city. So yeah, please take it away.
Thank you, Sophia. Hello, everybody. I hope you can hear me well. So let me start to share my screen. All right, you should be able to see my presentation now. So as Sophia said, I work at the city of Lyon. I'm in charge of the Health Observatory here. And so obviously my presentation will be focused on how Lyon collect and manage data, and will be focused on health as well, because this is my sector. So the Health Observatory, the idea is that the city of Lyon wants to scale up the use of data and improve its data management system. So we are seeing more and more observatories in the city. The idea is to collect and analyze data to improve the city's activities relevance in the health sector. So we want to increase the effective use of internal data, and also, just to say that one important thing when I mean health, we consider health as the WHO One Health approach. So we include human health, obviously, but also animal and environmental health altogether. And as part of the Health Observatory, also, I try to ensure data protection and availability of open data. Although, to be honest, we are not as advanced as the previous cities, but we are trying. Let me start with some facts about Lyon, so you get a bit more familiar with the city, and I can show also data that we have or that we have collected through other organizations, administrations. So Lyon has approximately 520,000 inhabitants, and is in the metropolitan area around Lyon is 1.4 million inhabitants. The city manages, for instance, 207 public schools with more than 33,000 students. We have 300 parks, so you can see the scale of the city and the type of data that we have to manage. But let's go into more health-related data. For instance, examples that I have been extracting for you today. We know that more than 20,000 inhabitants are affected by diabetes in Lyon, for instance. We have also data on healthcare. So we know that 638 general practitioners are registered in Lyon. I have precise data on appointments, so I can know that 240,000 dentist appointments have been recorded in 2024 in Lyon. On issues related to environmental health, for instance, we know that more than 29,000 people receive anti-allergic treatments. And I also have data about animal health. So we know, for instance, that more than 3,000 animal species have been spotted in Lyon, in the city of Lyon. And Even I know that more than 50,000 cats are registered in Lyon. So, like we have data about a lot of different topics. How do we collect data in Lyon? So I would say that, I mean, we mentioned that before with other examples, but we have here focused on internal data. We do have activity data. So for instance, we can know the percentage of children overweight at the age of 6 because the children are screened in schools for some few health elements. We know the number of nurseries overpassing indoor air quality thresholds. We know the number of inhabitants complaining about rats infestation. So that's the type of data that we can be managing. We do conduct also sometimes polls and studies, so we can know, for instance, the percentage of inhabitants considering themselves in good health, or percentage of inhabitants living in underserved neighborhoods who report difficulty in accessing health services. So that's like yearly polls that we conduct to monitor the vision of our inhabitants on the health in the city. Just to say that the details matter, and when I am mentioning these indicators, of course, we collect more data. Especially for activity data, we collect dates, geographic locations, gender, age groups. All of that is extremely important, and we use it in our analysis. An example also of data collection tool that we use in the city of Lyon. So in my department, there is a service that is in charge of hygiene inspections, like in restaurants, in houses. And so they use a software called Esabora. So this is a software where the staff can actually enter information about their inspections. The software also is the place where the data is stored. Data can be adjusted or completed there, reviewed, and we also have, and that's what you can see on the picture on the screenshot here, data can be analyzed. So you have stats, tables, charts, and all of that directly on the platform. As I'm expanding on this example, so this app has pros and cons. I would say, like, it's a fully integrated and digital data lifecycle. It's easy to use. It has, as I said, integrated dashboard and stats, and also a good thing, it's a French platform, so data is stored in the EU, which is something that we try to maintain as much as possible. But at the same time, like as you saw, perhaps the technology and the interface is a bit outdated, and also this platform is isolated. So data is not interoperable. It's difficult to transfer it into other platforms or dashboards. We also use a lot of external data. So I'm showing a few logos from administrations that help us to collect, to use information. There's the I don't know if you can see my mouse, but the French health insurance, the public health insurance, the National Institute for Statistics that have a lot of demographic information. There is the Public Health Agency, some partners, associations working on environmental health, air quality. So these are like, there's a lot of stakeholders around health. And so we try to collect data. We use their data basically. So we have agreements with some of them or some organization, and it's really developing and it's very interesting and useful. We have a lot of open data sources like platforms or even like open data libraries, I would say, that have a full data set that we can actually extract and use for our own benefit, I would say. I will not go back into the details of the data lifecycle because we mentioned it before, but just to say that like how it's governed in the city of Lyon is that each department is kind of responsible for all the steps of the data lifecycle with technical support from IT department or communication department or archive department on the different steps. Yeah, I will go back to the challenges of governance, data governance, because it's actually an issue in the city of Lyon because we are quite a big municipality, more than 9,000 agents. So things can be a bit complex when you talk about management. And here we go about the challenges actually. So the key issues I would say is having first, like, is the sources. I mentioned it before, and I will have an example afterwards, but having a full mapping of all data sources existing, whether they are internal to the city or external, it's quite complex. And I would love to have like a table that explains like all the data I could have and I could analyze, but it's not existing. So we have to build our own uh, catalog, I would say. The format is always an issue. So like if I go to an open data platform and I extract data, if it's a PDF, it's not going to be very useful to me because I will have to take the number, enter it by hand on my own tool. So that's not useful, and it's really time consuming. Then in data management, the system also is a big challenge because it takes a lot of structure. So organizing data, processing it, having ways to share data. So the system is quite a big challenge. And in relation to that, the appropriate tools I showed you before a tool that we are using. It's a bit outdated. It's not interoperable with other tools. So having the right set of tools is essential to have a good data management system. And eventually visualization, so making data useful and interesting. I mean, it's eventually we are not managing a big database just for the sake of it. We have to make it to make the best use of it, and it's a big challenge and in the city, I would say. But let's go into examples. I hope I'm fine with the time, but I'm showing examples to just to reflect on those challenges. So one of the challenges is that data in the city of Lyon is in silos. So for instance, like with relation to public building health and safety, um, we are in a difficult situation, I would say. We have it's a complex topic, public buildings, health and safety, because we intervene especially on pollution. So pollution related to asbestos, lead, CO2, all of that. It's a complex topic. There is a lot of regulation in between public health law and environmental law. It's a sensitive topic also for the citizens, and especially in buildings that receive vulnerable public. And Lyon has a very old estate. Our buildings are very old and costly and difficult to renovate. And for that, we have limited capacity and tools in data management, expertise and knowledge is scattered among directions on the, let's say, the technicality of public building health and safety, but also in terms of data management, it's all scattered between their directions. And we have a few and outdated information systems or data management tools. So for instance, it's a bit of a headache because data on buildings is in the properties department, and data on contamination and controls is in the health department. Data on repairs and building management is in the works department. So it's all very complicated. Like when we try to assess and have a global analysis on the status of our public buildings health and safety, we have to gather data from dozens of different Excel sheets, and it's really a headache. And we don't have an information system that is centralized at the moment. So just an example of how complicated it can be to manage data.
Pierre-Louis, two more
Yes.
minutes. 2 more minutes.
Okay. Okay. Quickly about another example. Especially in terms of geographic data, it's important to have a detailed geographic data. For instance, we know that 20,000 people have a chronic diabetes in Lyon, but and we want to work for that. We want to have adapted programming at micro level to have prevention programs. And the French public health insurance is providing us data, but at the whole city level and not at the neighborhood level. And we would like to have detailed data. We are fighting with them to get that information. I was in a meeting with them yesterday, and they just keep saying maybe later we can provide like data at the neighborhood level, so we can know in which neighborhood to focus. But for the moment, it's still quite complicated. So yeah, just as perhaps as a wrap up, we are having a few solutions and way forward in how to improve in terms of data, especially data governance in the city of Lyon. So for instance, we have recruited a chief data officer that is trying to develop a strategy and create a system for data management in the city of Lyon at the whole of city level. We will be creating a data catalog. So as I was saying, it's going to be very useful. We will be having a standard set of data tools also because different directions use different tools. And this is already existing. We have a network of data enthusiasts or people who work with data within the city of Lyon, and it's actually very useful to be to share good practices, updates, progress, and so on. And perhaps as a final slide, so we are in a momentum to reduce our delay in data. I would say that we are a bit delayed compared to other cities. There's a wide effort among all directions to deploy data, to recruit data analysts, to have a advanced information system, and there is a strong willingness and interest from both directors and citizens at the same time. So yeah, we are moving forward. I don't know if I have 1 minute, but I have an example of success. I don't know, Sophia.
Oh, I think we can move on. So we
Okay.
have 3-4 minutes to close
All
the
right.
webinar. Thank you
All right.
so much.
So yeah,
Here
you're
it is.
welcome.
The slides will be available, so you can see also the final example.
Thanks.
If you have any questions, there's still a bit of time that we can answer to you. But otherwise, we can go back to our flow of our presentation for the closing. Yeah, there's a question. I think this is for Jenny. I don't know if you want to take it later, the access and the data about this meeting. Otherwise, I would say let's go to our next slide. I don't see any other questions. This we will take it in the end. Wait, just maybe this one question that I see here in the chat. There is a question that says if there is any training to the officials for the use of data. So asking all the municipalities that are here, like Lyon and Vitor, if you do training to the use of data to your officers.
I mean, it depends what we mean by training, but like there could be training about the use of a specific software or system. So this is happening, but like globally, I would say in terms of data management, no, there is no training, and it's actually a topic, and we will need to develop like further understanding at the whole of city level on how data can help us be useful for our work.
Thank you. Vitor, if you're speaking, you're muted.
Yeah, sorry, I lose my connection, so I don't know if you have a question. Sorry.
If just a question from the public, if you are training, if there is a training for the officials, for the officers to use the data.
We are working with an association with data scientists, and we are now create a training program for our department.
Okay, interesting. Yeah, okay, we need to maybe follow up on that to see like what you include in that. Thank you very much. So looking at the time, it's quite tight. So we will go to one more time question to everyone. If you have other example cases that you want to share with us, just name your city and a bit the content of your social policy or of your tool or something else you want to share. And we can collect this for the guidebook that we are developing. And here is again the QR code.
Indeed. I hope you are still connected or can connect once more with the QR code or through the website, and then maybe share your examples or other cases, some practices from your city on social data management and how to collect and best analyze data. Do we have other cities in the room?
I think we do.
We do. Also very good. Working on it through EUI, get some support from wherever.
Remember to type also your city so we know where you are from. We were included already. I guess it was one of the cases that we showed in the earlier presentation. Okay, I think we can close this, and we are curious and interested to hear about more examples. We want to share knowledge. As we said, from where you are, from what we are working, we don't want to impress each other, but to just learn from each other. So feel free also to get in touch with myself, with Margit, with Mar, and the others who are involved in this Knowledge Hub activity. One more question arrived. And just going a bit as a wrap up for this webinar, as we said, we need to build trust with citizens, combine social data collection and analysis method, physical and digital, for validation and accuracy. We've seen examples that not only one source is enough. Co-create data collection and management solutions with citizens, as well with other organizations who are doing similar work, with other departments. So it's important, the collaboration part. And data strategies, governance is important, especially for social data where additional challenges exist. There's more sensitive topics, so we need to have that. And something that I take from Quopio, data is only valid when it's utilized. So that's our message for this session. And what is after that? We have a question. If this webinar increased your knowledge?
Yes, indeed, that's our last final call for a little feedback. This time we do that through Zoom. I think Jenny is launching the little question, whether this was useful for you.
I will. I'm just responding. There are two questions
Okay.
at the chat, though, that I think it is worth taking.
Good.
I'm about to respond to one question I just received about if there is any training for officials to use data. So I'm just sharing in the chat the portal European link with a European portal that offers this kind of courses on data. But at national level, there might also be courses that you need to check also with your ministers, the ministries at national level, whether there is something more for at national level. And there was another question that I see that is being responded to about the city of Famalicão, how they have been collecting data. So let's give some time to Vitor to respond. I don't know, Vitor, if you prefer to take this online, so you can take the floor perhaps.
You're muted.
Yes, sorry. I'm right now, but we start collecting data 2018, and yes, the politics are involved in this because it's very important. If they aren't involved, isn't the same. We need the top management involvement.
Right. Okay. Very clear. Very clear. I have also, thank you very much, Vitor. I have also launched the poll. So this is also very important data for us to know whether this webinar has increased your knowledge on the topic. These are this kind of indicators that we also need to feed in and report to the Commission also. So please, so we have, right now we have a lot of participants still in the room, so please, I draw your attention to the poll that you may be seeing in front of you. So let's give a few seconds more because we're coming to the end of the webinar. Perhaps, Margit, you'd like to close while the poll is still open?
Okay, yes, sure. I can do that. To close, I just want to show once more the little overview of the whole webinar series and thank first of all the speakers from today. So from Kuopio, from Finland, we had Kati. From Famalicão, in Portugal, we had Vitor. Thank you very much. And also to the city of Lyon, Pierre-Louis. Thank you very much for your really interesting contributions. And special thanks, of course, also to Sofia Aivaliotti, our expert, who guided us through the webinar today. You will see that next week we have already the next session. Next week, Thursday, again at 10 o'clock, we will start and have then a session together with the city of Oulu and Heerlen. Thanks also to all the participants. Thank you for sharing your thoughts, questions, and being challenging. And don't hesitate to still get in touch with us after the webinar if you still have ideas or contributions to make. We're very open to further input. And of course, as we said before, we will share the slides afterwards on the dedicated webpage so that you can find all the information. So thank you very much. I hope to see you next week again, and I wish you a good day. Thank you. Bye-bye.
Thank you. Bye-bye.
Bye.
Thank you.